about your health and whether you want that protection or not. It really doesn't impact me or anyone else.
Well, that's not true at all. I mean, obviously it's important for you as an individual for your own personal protection, safety, and health. But when you have a virus that's circulating in the community and you are not vaccinated, you are part of the problem because you're allowing yourself to be a vehicle for the virus to be spreading to someone else.
The fact is, it is spreading regardless of vaccination. I mean, that's just the reality. The theory behind a vaccine passport is, okay, if you force everyone to have it in order to kind of live in society, then you'll be able to basically just nuke COVID. But we know that that's not the case. At the end of the day, though, it's about your health and whether you want that protection or not. It really doesn't impact me or anyone else because we've seen the data on this.
If he feels that vaccines are not important for people, that they're just important for some people, that's completely incorrect. Vaccination, Jim, has been the solution to every major public health issue in which a vaccine was developed for. I mean, smallpox, polio, measles. I'm not sure what people are talking about when they push back on vaccinations. It is historically, over decades and decades and decades, shown to be the way you control an infectious disease. So it isn't as if it stops with you. If that were the case, then it would be only about you. But it doesn't. You can get infected even if you get no symptoms or minimally symptomatic, and then pass it on to someone who in fact might be very vulnerable, an elderly person, a person with an underlying disease. So when you're dealing with an outbreak of an infectious disease, it isn't only about you. There's a societal responsibility that we all have. We will get there depending on how successfully we vaccinate our population. If we get more people vaccinated, we really give a big dent into that 75 million people who are eligible but not vaccinated, we will turn this around from the standpoint it will no longer be an outbreak. It will be there, you're not going to completely eradicate it, but right now we are in outbreak mode. We have 160,000 infections per day. That's pandemic. We can get that way, way down. We may not get rid of it completely. You may see intermittent cases that'll come and break through, which will be manageable. It will not interfere with our lives. It will not be a public health threat. How soon we get there is dependent on us. It's how soon we get those people vaccinated who are not vaccinated.